West Africa continues to reel from the devastation of the disease, where the CDC reports about 8,400 cases of Ebola. The virus has led to more than 4,000 deaths, and that number is expected to climb. But Debora Patta is on the ground in the Liberian capital of Monrovia, where international efforts could start paying off.
Good morning. Liberia's poor health system and a lack of beds have up until now been the biggest problems in trying to contain the spread of Ebola. But slowly, new treatment centres are being built which could triple the capacity to deal with this disease. Construction continues around the clock in Monrovia. This is the first of 17 planned Ebola treatment units that the U.S. military is building across the country.
Two separate treatment centers of 150 beds each, so it's sort of a mirror image. You see down the middle splits the two, but this is the triage area.
America's ambassador to Liberia, Debora Patta, says they wanted to build a place where people felt comfortable enough to bring their loved ones.
We are still encountering some denial. We still have some work that we need to do in that regard, but I think people are starting to understand that they need to protect themselves, they need to protect their families. The big constraint has been, until the last few weeks, is the absence of places to take those sick people.
This centre could be ready within days and will have 150 patient beds. The international health agency Doctors Without Borders has been in Liberia for months and operates 5 large Ebola centres with a total of 502 isolation beds. Laurence Sali is one of the group's emergency response coordinators. She agrees help was needed months ago, and while grateful that it's on the horizon, it is nowhere near enough to contain the epidemic.
We need more people to work in the isolation centers. It's not enough to have the empty structures. We need to have people to manage those structures. What will take time is to train the staff that will be working in the center.
Here in Monrovia, the message is starting to slowly get across that behavioral change and proper sanitation are crucial to fighting this disease. It's difficult to enter a building in the capital city without having to wash your hands in chlorinated water and have your temperature taken. But Doctors Without Borders remain convinced that the death toll is a lot higher than statistics show, because many people are still not reporting all cases of Ebola. Jane?
Debora, thank you.